Hey everybody, it's Nina at Self Care Adventures. I did my Moxie laser treatment in office and I did make a video about the treatment, what it is, and everything about it. So if you are wanting to watch that, it's pretty detailed and just good information about the procedure and the science behind it. This video is for my recovery. This is the first day at night. I had my treatment in the morning at 9:30 and it is later tonight at 9:30 p.m. So it's been 12 hours. This is my face. It's still a little red. The discomfort did go down around 2 to 3 hours, and by tonight I don't have any pain. I haven't washed or touched my face, so I don't know how it's gonna feel in the shower. I wanted to give you a close-up of what my face looks like. So this is the front view. My left side, you can see the microscopic epidermal necrotic debris that's supposed to fall off. You can see the little dots actually. Even though it's not ablative, that means it's not going to remove the top layer of your skin. You can see where the laser went. This is my right side. Here's my front view, close up of my face. I also did both of my hands, the outer part, but not my fingers. Right after the treatment, my hands did look bumpy, a little red, and like I had an allergic reaction, but it was light. It's gone down after a couple hours. I don't feel any more pain, so that's good. Again, in my last video, I did talk about this, but basically I went in, they gave me a numbing cream. I applied it 30 minutes. She talked to me about the procedure, did her treatment. It took about 10-15 minutes. It was pretty painful. The numbing did help, but it like the halo laser that I got 2 months ago, the pain like hot, tiny microscopic dots. They use a handpiece over your skin horizontally, then vertically, and then diagonally at each part of your face. They zone it in sections: forehead, chin, nose, then your neck, then your chest, and then your hands. And that took about maybe 15 minutes or so. But yeah, I just wanted to give you a heads up of day one, nighttime, after about 12 hours. It doesn't look bad. You can see the dots microscopic on your skin and it dries out. Lighter coffee grains. At least it works. And I think she did do a higher setting on my face because it shows more than my neck, chest, and hands. After she did my face, it was hot. So she brought it down and I felt better. The higher you go, the more benefits, but longer downtime, but probably better results. And your fine lines and wrinkles, reducing hyperpigmentation, and reducing all those concerns that you have. I guess it's good. She went on high setting on my face. I'll let you know if anything changes throughout the week. If it's hot, it's going to burn. Wash with cold water. It's more soothing. If you have hypochlorous, get that at the spray that helps keep your skin clean without touching. If you have a hyaluronic serum to help with hydration, you can use that. Or like me, just wash your face, don't touch it. And if you need to, just wash your face throughout the day with a gentle cleanser. But if you want to make sure throughout the day, then you can have that hypochlorous mist spray and spray it throughout the day. And then with the hyaluronic serum, you can apply that twice a day. You need it for the next 2 weeks. Another thing with my washing your hands throughout the day, for that initial day, fill your hands with the water. Just make sure you are rinsing with cold water, and that should help soothe it. But that is the only thing I didn't even think about. You're always washing your hands. A day or so is not too bad. The discomfort should be gone compared to the halo treatment, which is fractionated ablative laser that will remove the outer layer of your skin. So hopefully this is all worth it. I'll keep you guys updated. Moxie is the baby version. Halo is in between, and CO2 is the full ablative laser. So with the Moxie, it's non-ablative, so it's not going to ablate your skin. You would need about 3 to 4 Moxie to equal 1 halo treatment. And 2 halo treatments equal 1 CO treatment. The halo dual wavelengths, non-ablative and ablative. CO2 is a full ablative. It would take 6 Moxie treatments to equal 1 CO2 treatment. Moxie is more for preventative, rejuvenation, maintenance treatments, usually people that don't have major issues. Halo is more for moderate sun damage, fine lines, wrinkles. CO2 is for deep issues, wrinkles, acne marks, significant signs of aging, and you want to fully uplift your skin, but it is more downtime. So that is the only thing with the downtime compared to the others. Halo is to repair and refresh. CO2 is to fully correct. Need multiple treatments to get the most optimal results, and because you're always aging, needing to correct damage. I'll give you updates. Hey everybody, it's day 3. I just washed my face. No makeup, upper cheeks, redness has gone down. Here's my face close up. Left side, right side, forehead, tiny dots. For the most part, it looks pretty good. Wear your sunscreen. I just wanted to give you an update. I'll see you later. It was day 4 after treatment, and this is my face today. It's looking a lot better. 20 to 30% of the mins came off. Last night, I used a gentle cleanser, and I did actually use one of these silicone face scrubbers. The silicone is gentle and will help remove some of the mins off, but is not too aggressive. I thought that was clever. Even if you don't have it, you're fine. I used gentle cleanser and I massaged it gently with a little pressure, but not pick or scrape at your skin. You might cause post-pigmentation. Wait until they naturally fall off. Sometimes you have to encourage them. It would stay on my face and stick on my face, and it's actually irritating and itchy. So that is an option to either just use your hands or help use a more mechanical face scrubber, silicone face scrubber to scrub your mint off. But I'm going to show you what I use. I'm using the Beauty of Jason cleansing balm. I also use the CeraVe cleansers, but I ran out of the hydrating cleanser, and I used the oil-free cleanser to take off my sunscreen. I do a double cleanse to take off sunscreen and debris to clean impurities, and have a base for products. I love their products. Their products are nice, gentle, and very affordable as well. So they did recommend me their products, obviously, and I'm sure they work very well. I did use one of their face masks last time. It was very hydrating, but I don't recommend it after halo treatment because your face has a lot of open channels and stinks quite a bit. Wait a day or 2 before you use to put anything face, honestly. But for this treatment, it's a little bit less aggressive because it doesn't ablate the outside layer of your skin. Usually wait a day before you cleanse your face, but I don't necessarily put serums or face masks or lotion or anything. I just wait the day after for your skin heal overnight. You just need a little bit to emulsify it with water, turn into cleansing foam. It's very nice to bring this to travel too, since it's solid. It's easier at night because I'm in the shower. This one doesn't foam, but it's still very nice and gentle. Just gently massage and it takes off, hanging on, but wanting to come off. I wanted to show you what I do. Use whatever you have at home. A lot of came off. My face is clean. The only thing about micellar water is you don't get that refreshed feeling. It depends how I feel that day. Day 6, and I wanted to give you an update. I haven't washed my face because I wanted to show you what I'm using. For nighttime, I've been using my silicone facial scrubber. I have 2 different ones. A non-mechanical plain facial scrubber, and it has a elevated suction cup on the back. And the brand is K. It is a little worn down, but it works well and I enjoy using it. This is the rechargeable brand. I didn't know the point. Usually I'm one of those people, less is better, but I did a little bit of research of the benefits of using these, and I actually do enjoy using it post-procedure. I might start using it more because it's supposed to break down sunscreen. I usually don't wear makeup, but if you do wear makeup, then it would be beneficial for you to help break down that makeup and debris, any products that's left over on the face. And it's antibacterial, clean, gentle, silicone, and I like both. You can control the pressure. This one's more budget friendly and travel friendly. Sticking it on top of the container, and it works well. I enjoy both. Sometimes I want to use the manual. Sometimes I want to go in a little bit, be lazier and not use it as much, or I might get more off since it has that vibration. Maybe remove more sunscreen. The tapered pointy edge, it adapts well under your eyes. You can see how well it adapts all over the face. Super easy to recharge. I haven't had to recharge it this week, and I've been using it. Anyway, I think it charged pretty well. I've been using the Beauty of Joe's cleansing balm. It doesn't foam much, but it's nice and gentle. And I like it because it could be good for traveling. And I've been using the Skin 004 Madagascar Brightening Cleansing Foam Gel. I prefer foams. I heard foams are more drying, but I like the feeling and I prefer foams. Color should be gentle for sensitive skin. This brand is gentle and I like their products. I've been trying to use it up so I can try different face washes. So that's why I've been using it. For the brightening, I'm not sure if it's good. Wash might be irritating, but again, this is my skin and I haven't had any issues, so I think I'm okay. But ideally, you probably want to use something gentle like CeraVe. I've been double cleansing with this at night. This CeraVe Hydrating Foaming Oil Cleanser. I love all CeraVe products I've used. It's budget friendly and good for dry skin cleansing. You can remove oils with the oil cleanser, and then you go in with your water-based cleanser to remove any other remaining molecules on your skin. I've been doing that at night. And in the morning, using my Beauty of Joe. I've been trying different products to see what I like. If I had to rate all three, this is my number one. All CeraVe products I enjoy. They're good and gentle, and they work for me. And I don't get any irritation. Number two is probably the Beauty of Joe. I really enjoyed it because the first time I used this, I never had used a cleansing balm before. I didn't know that was out there. Pretty amazed. I thought I can travel with this. It's solid, cool, easy, contained, super sanitary. At first, it had a plastic cover between the spatula and the cleansing balm. I threw that away because I didn't understand the reason for it. I thought that was pointless. Now I understand it would have been better to keep the spatula separated and keep it organized and clean. Yeah. Anyways, I will keep it next time. I would put this third, even though I enjoy this brand, because I don't know if I saw any brightening effects from this cleansing foam. It is gentle. Would I repurchase? Probably not. I do have other products I like from this company. Let me show you how to use this mechanical on electric. So it has a on button right here in the middle, the circle right in the middle. Hold it, it'll turn on. Can you hear that? If you increase it, I think that's the highest. This is the lowest. 1, 2, 3, 4, 5, 6, 7, 9, 10, 11, 12, 13. I think there's 13 levels. I don't feel it going down anymore. I think there's 13. Let me see. What's a good level? Level 6 or 7 is probably good. Okay, I'll use the cleansing Madagascar. Let me put it on. Put a little water on it. It's waterproof. I can shower in it too, which is nice. I did skip day 5 in recording, but you can see how well it adapts. It does most of the work for me. It's nice because I go over my lips like a lip scrubber at the same time. I go all over my face. I do this for a couple minutes in the shower, on my neck, chest as well. After the third day, maybe every day after that, it's 5 to 10% that comes off each time I wash my face. We'll reevaluate my face and see how it looks. But apply gentle pressure. I turn it off, rinse it, let it dry, and it's clean, ready for next time. So wash my face with cold water. Just like everybody else. So there might be something that might not ideally do perfectly, but again, I'm just using what I have, testing it one day at a time. But products like the brightening wash might not be ideal. Test it out. If you get skin irritation, stop. Go with your gut. If you have any reaction, stop using it. Go with something more gentle. I haven't had issues. Except for one. This is my face on day 6. Close up. Left side, right, my neck, and hands. Honestly, it looks the same. They're all just hanging there. I'm not too worried with my hands because no one will notice. They're tiny. You can't tell unless you look close. Smaller than the halo ones on my face. I wasn't expecting that because I knew it wasn't going to ablate the outer layer of my face. I was surprised to see that after I did more research and saw it the next day or that day of. So there you go. I did what I needed to do throughout the week and I saw people. So it didn't bother me looking in the mirror. My face, most men's in the T-zone, around my eyes, cheeks, more than that happened last time too. The border is harder. Where it's positioned, it doesn't come off as easily. 90% of it came off. That's nice. So I think more is going to come off later tonight. I'm going to go over more things I've researched, or maybe it'll help you learn a little bit more about it so you can decide if you want to do this treatment or not. Overall, it looks nice. My pore size always goes down, which is nice because I've never really paid attention to my pore size. My face is brighter right now. Maybe the face wash is working. I don't know. But anyways, I would say the pigmentation, dark spots are fading around the cheeks, which was my main concern. Fine lines and wrinkles just improve my overall skin. Looks like my skin is more even tone. Texture, nice and smooth. All pluses. Do I think it's worth it? Yes, I did it once. Would I do it all the time? Probably not. I don't like the downtime and it was painful. My main concern is dark spots and hyperpigmentation. I do think BBL light treatment's better to get rid of those pigmentations. It's more focused on that. Each of these treatments, you're supposed to do it every 3 to 6 times. That's a lot. But I do think it is worth it in the long run. I did get into areas connect with home devices. Yes, I think it's worth it. Probably max 2 or 3 times because of my skin condition. I don't have any major issues and I don't have really main textural issues. My main concern right now is dark spots, hyperpigmentation, sunspots, freckles. This Moxie does help with that. Overall, it is beneficial. I won't know until I try it out. It's good to know what the process is and see what kind of benefits and effect it does for my face. And again, if it works for you, keep doing it. Documenting my experiences, you can see if the procedure fits for you. I'll take a picture, compare day 1 to day TBD on the final day, but it might be tomorrow. I don't know. Because the halo, I took 7 days for my face, but I still have on my neck. The halo treatment, I didn't do my neck or hands. So it is a little different. If it was just my face, it would probably come off by then. But since I'm adding my neck, my hands, it might take a little bit longer. But at least for my face, I can go back and do other devices and skincare, which would be nice. It did fade my spots a little. It's evening out my skin tone. I'll give you an update later. Now we're going to talk about the Moxie. I just want to mention that I'm not a professional. I'm just learning as I go along and sharing what I'm learning to the world. Hopefully it can help you understand skincare procedures one day at a time. Knowledge is power. So back to the red light therapy. So why is it near infrared? Red light therapy. They have different penetration to the skin. With regular red light, the 630 to 660 nanometers can go 2 to 5 millimeters into the skin. Near infrared can go so deeper into the skin. Our skin is thin, so everything is precise, okay, which is great. So you can treat certain concerns. Red light is ideal for the epidermis. Most of the collagen live. For the most part, that's what people are trying to increase. That's where the capillaries and the blood vessels are located. It's good for skin rejuvenation, wound healing, inflammation reduction, boosting collagen production. The near infrared penetrates the deeper dermis of the skin. It can also reach the fat and muscle layer. Treated for pain relief, joint health, deeper tissue healing. Red surface to mid-level skin, making your skin smooth, firm. Near infrared, deeper healing, repairing from the inside out. By introducing near infrared, and going deeper into the skin, up to 15 millimeters, it can interfere and overstimulate collagen production, increase the heat load when the skin is inflamed. Increased circulation might increase swelling and redness. Boost up the blood flow. Sounds nice, but like I said, it'll amplify the swelling, prolong erythema, redness, flushing, and hyperpigmentation. But once your skin is intact, start in shorter sessions, low intensity, apply it to healed zones. Wait until after, because the mask is your full face, and panels usually treats neck, face. It spreads out more generally. Be safe, use red light. Post-laser, after you're fully healed, soothing barrier creams, a cold compress, thermal spring water, hydrate, and sunscreen. Too much too soon or the wrong skin type can delay your healing process. That was a long explanation of red light therapy. Hopefully now you can understand it. Other question was, can I do eye treatments since I didn't get my eyes treated? It says yes, you can. I have some good recommendations. You can use your NIRA Pro once a day, or if you have the Derm Revive, this is awesome and amazing. Obviously, I have a discount code if you're interested. Less, once or twice a month. If it's between treatment and you're due for it, you can use it. Ideally, you don't want to overlap treatment areas. One laser beam means it's not a whole bunch of lights. Like fractionated lasers, like this one, like Moxie, is all fractionated. These are not, so it should be safe. The treatment zone should be concentrated and it shouldn't overlap your under eyes above my eyelid as well. Consult with your provider if you're unsure, or if you don't feel comfortable, then don't do it. But that is what I'm doing. I'm mainly using my NIRA, since you only have to do this every once in a while. I know I have a lot of devices, but I try to use all my devices. How to use it will benefit you, so you can strategize each device, the benefits of each device, and incorporating all these devices and using the most at the devices. This is the Solar Wave wand. Uses red light. I know I was talking about red light, not yet, but since my under eyes wasn't treated, you should be able to use it. And I like this because it's nice and relaxing. It has a warmth feeling, and it uses red light to helps reduce dark circles, fine lines and wrinkles. And I like it because it's small, and I usually just use this mainly for my under eyes, maybe once in a while my whole face. It's easy to use, gentle. I used to have this, got rid of it, but this is one of the things I brought back because I think it did make a difference. Even though all the things that I did have, some things I might be bringing back because I did still see a difference, and I wanted to just see what was out there. I repurchased it. It's prettier than my last one. Blue and pink. It will sense your skin and turn on with red light. I'll link it at the bottom. You can do your under eye, close your eyes, go across your skin. It can treat on top of the eyelids. It's supposed to also have microcurrent. Microcurrent uses low electric currents to stimulate muscles and skin cells, help with collagen and elastin production, firm up skin, reduce fine lines and wrinkles. It's a win-win. Local treatment, then I think this is perfect. And it's lightweight. You could travel with it. I think it's great. The Medicube HRI device, magnet with 5 levels.
Booster mode, level 1.
Booster mode.
Level 3. Level 5.
5 modes. I like devices specifically for the eyes. Adapt better to the eye region. Eyes are very sensitive, better, and you can be more precise. The air shot, it's like microneedling but in electric form. Both help with product absorption and just help with your under eye issues in general. So these 2 combos would be perfect, especially post laser treatment, post in-office treatment. Isn't that nice to treat your face even though you just had treatment? Anything's possible. And back to the treatment. Treat the eyes with those products. I've been using these last couple of days. It's been working well. I recommend it. I haven't used these long term, but I like how they work. This combination would be beneficial. I plan to keep trying them out and adding more. I like to do everything at home if possible, just like everybody else. All right, the Pro, the Derm Revive, use specific, just like the Moxie, a specific wavelength to penetrate the skin to help stimulate collagen production. This is going deeper
at a 1064 nanometer depth. This is a 1450 depth, so a little bit more superficial in my understanding. These can be used synergistically in a way, but strategically. So if you want to use both, you can always use this prior or during your treatment, 48 hours, and then you could use this every day or change it up, use your booster. With the NIRA on the same day, listen to your skin, leaning towards just using one of these, one, either morning or night. The NIRA every night, and interchange it with one in the morning. Use the air shot only 2 to 3 times a week. Use the booster every day if you want. Test it out, make sure your skin's not reacting. If it is, stop. Those are not working. Here's some other alternatives. You can use a nice to your eyes or to your face. Use a hydrating eye mask. Bean hydrogel eye patches. These are nice. You just open it. It has this cover. It's separated, organized, and clean. Come with 30. Super hydrating. I use this on special occasions. It would be great in the morning if you have time and fit nicely underneath the eyes. If you put it too close, it can irritate you. Have a little bit of a distance, especially if you're treating the eyes only. That's a very nice eye patch. Spatula back in and replace the lid. Travel friendly, hydrating. Notice my eyes are more plump when I use it. Also, I have this too that I bought. It's a reusable eye patch. After you put your eye cream, you can use this silicone patch. There's 2 sticky eye patches, a cover, and it works well. You can see it just stick on your skin. Over time, it does come off a little bit, but you can stick it back on and reuse it. I haven't used it in a while. I just kind of forgot about it. But yeah, that is another option. Eye patches. There you go. And if you have any simple eye creams, use that. I'm using the Estee Lauder Advanced Night Supercharged Gel Cream. Synchronized Multi-Recovery. It's a nice glass bottle. Would I repurchase this? I would probably try other eye creams before I repurchase this. It wasn't bad, but I wouldn't say I loved it. But you can see it's definitely gel cream. I've been using it for my under eyes. It's a thick, lighter texture. Perfect description. And I've been using it with my Medicube device, eye device, and the Solar Wave. Because with the Solar Wave, you need some kind of cream before it would work. I've been using my dedicated eye cream at the moment. It's pretty strong. You can feel tingly feeling. I don't know if I like that. And I don't know if I've really seen a difference now. I haven't used the whole thing. I do like eye creams. Before I was like, do you really need that? Can you just use all your other skin products underneath your eyes? You probably could, but eye creams are more gentle and tailored to your eyes. Sometimes you need gentle ingredients. Skin is different underneath the eyes. That's what I think. Do whatever you want. But yeah, anything with peptides, does have a lot of peptides, and that's why I continue using it. But ideally, this might be too thick, too opaque. I don't know if this is ideal for the Solar Wave. It did come with its own serum. The Solar Wave Renew Activating Serum has blue and hyaluronic acid and aloe vera. I like this. I think this would be better to pair with the wave it was meant for. I might keep this bottle though, because this is a nice bottle. All right. But yeah, ideally you want to probably have something more clear, transparent, to let the LED fully penetrate and go through the skin. A clear texture eye cream. It might pair well with the booster because this is electroporation to help boost. It uses different technology to products into your skin. This might be ideal for the Estee Lauder eye cream. Avoid anything with retinoids, vitamin C. You can use caffeine under eye creams. Go back to your regular eye cream if it doesn't hinder your treatment zones. For your whole face, don't use anything active. I thought I had a great product. You might use, your skin might be different than mine. I'm using the Comfort Ceramide Spray, and ideally this should be great for your whole face after a couple days. But I don't know, my skin seemed a little irritated, so I'm going to use this after my skin is healed and then start using this. My recommendation is use things that are hydrating, like ceramides, things with peptides, things like that. Our X ceramide spray and the skin booster, 6 peptide booster. I like both when my skin is healed. Honestly, the booster, even after I have the mins, but so it's day like 5, 6, and most of my mins have come off. Take it at your own risk. These are budget friendly. I highly recommend these 2 products. Try not to put anything on your skin. I just see how my skin reacts so I can know in the future, because I'm probably going to get more procedures later on. And so if I am doing this after a more intensive treatment, it should work for home devices as well. Don't use any vitamin C. They're great for pigmentation and brightening, but it might compromise your results. If you want to be safe till all the mins come off, then go back to your skincare. During the healing process, use a gentle cleanser, barrier creams. I'm using Cetaphil moisturizing lotion. This is my go-to forever and ever. And I've been using the La Roche-Posay daily moisturizing lotion, and it does have niacinamide shea butter. You probably want to wait, and I did try it. I don't have any irritation. I'm running out and I want to use it up. Super gentle and nice. The hydrating cleanser is like $10. Any hydrating and barrier serums, like the ordinary hyaluronic acid serum, it's lightweight. The Geek Gorgeous hyaluronic serums. Now I haven't used those 2, but they're options for you. Hyaluronic is usually very hydrating, keeps your moisture in. I'm gonna list everything in the bottom that are options. I haven't used all of these products, but some. The ones that I do use, I'll put a parentheses and let you know the ones that I do use in the description. Even if the ones I use might not work for you, I have to test things out. I'll add the ones I enjoy. The other ones are great. I think I will use the ones I recommend. These products take time to use. I don't know how people have so many products. These products expire, so I gotta use things one at a time. I'll let you know which ones I like. I'll list everything below. Your routine should be cleanse, hydrate, barrier cream, sunscreen. It's super easy, super simple. Less the better. Even though I might be telling you this, it does have niacinamide. For some, it might be irritating. I usually don't get irritation, but like I said, make sure you check the ingredients and you're aware that you might get some irritation in the skin. In general, this product, even though it says niacinamide, it's probably a low dose, 4% or less. 2 to 4% is safe for most people for sensitive skin. 5 to 10 is more for oil control or acne or pigmentation, but it can cause irritation. 5 to 10%. 10% is like overkill. I just learned that. And you have the risk of tingling, dryness, and flushing. With the right percentage, it could be beneficial. If you're usually able to use this product, most likely you're okay. This is good for sensitive, normal to dry skin. It has thermal water, glycerin, shea butter. Glycerin is a humectant. It draws water from the environment into the deeper layers of your skin. Great for dehydrated skin, post-procedure care, and longer lasting moisture. And shea butter in the main ingredients, it's a rich emollient. So it's loaded with vitamins and fatty acids. It seals in hydration and prevents water loss. It has anti-inflammatory properties, help reduce sensitivity and redness. It nourishes the skin. It contains vitamin E, A, and essential fatty acids. It helps with skin regeneration and helps repair the barrier. Ingredients like that should help keep the moisture, keep your skin hydrated. And the thermal water, a nice, natural, rich mineral source of water, comes from France. So you know it has to be good. And it has skin calming properties. Anti-inflammatory, helps reduce redness, soothes the skin, antioxidant. It contains selenium, a trace element, protects from oxidative stress. It's a gentle hydration. Spring waters for therapeutic body regeneration. It's supposed to have therapeutic properties. You don't have to go to France for that. Light moisturizing, great for post-procedure. Deep hydration, shea butter. And so that's all the properties for La Roche-Posay lotion. Cetaphil has avocado oil, vitamin E, vitamin B5, vitamin B3. So those are beneficial. Vitamin E is an antioxidant, helps protect from oxidative stress like UV rays, pollution. So vitamin B5 and glycerin hydrating, vitamin B3 and fatty acids are barrier repairing. Avocado and antioxidants are soothing and protective. It will help strengthen your barrier and keep it nourished. Those are options I've enjoyed.
The benefits of red light therapy for Moxie. There's multiple wavelengths, multiple light. Near infrared is around 850 nanometers. Red light helps stimulate ATP production, which is the energy of cells. It promotes collagen synthesis, reduces inflammation and redness. That's what I was hoping for. And help with wound healing. Perfect for post-procedure treatment. It depends on the timing and your skin condition the next 2 weeks. Everybody's different, but in general, this is the general understanding and recommendations. So again, Moxie is non-ablative. It still creates micro injuries to the skin. By day 3, still might have redness, irritation, dryness, flaking, and rough texture from the treatment. Red light therapy, non-thermal, but the LED's still a little residual warmth. If your device is close to your skin for 10-15 minutes, I leave my mask for about 3 to 9 minutes. If it's close, you can feel warmth. More powerful panels, it might be more noticeable. If you stack it with near infrared, it might hinder results. Your skin is super sensitive. Introducing red light therapy might cause irritation. For the most part, all of the things I asked about the healing process and not letting your skin naturally heal. Red light is non-thermal. It can produce a minimal surface level heat, especially if you have longer sessions and a higher power device. For the most part, it's not a big concern, but if you're healing, you should avoid it. If you don't have super sensitive skin, go with your gut. Use a gentle, low intensity red light device. Okay. Start in short sessions, like 5 to 10 minutes, max 15 minutes. Have a panel, keep it at a distance from your face. Don't use anything active. If your skin is irritated, stop using it. If unsure, ask your provider. Wait 5 to 7 days after your meds are gone, then restart red light therapy. That's what I'm doing, except for my under eyes. Should be fine. Use red light while having the microscopic epidermal necrotic debris, those tiny dots, part of the healing process. Let that naturally shed off your skin. Red light can increase circulation, hinder, and disrupt the shedding process. Even though it's a non-invasive, it could overstimulate. Red light therapy can help with ATP production, help with cell turnover, and help with collagen synthesis. You would think that would be better because it would make your come off faster, but faster is not always better. It should help, right? To increase the mitochondria activity, so more ATP and energy for the cells to go to work. It should promote keratinocytes and fibroblast activity to promote collagen and elastin. The keratinocytes to turn over, which is the cells on the top layer of your skin, to fall off. And naturally, it should help speed up the tissue and repair regeneration process. It should help with microcirculation, bringing more oxygen and nutrients. In theory, you would think red light should make me go faster. Yes, it might, but you still need to wait. Your skin is healing in layers, like carbonized skin microcolumns of the skin. So what's carbonized mean? When the laser is going into your skin, it heat up your skin and light up with energy, right? And cause micro injuries into microchannels into the skin. Microscopic columns, wells into your skin. Those wells are necrotic, dead, dehydrated, slightly charred, oxidized by heat, burnt. It will give a dark speckled look called carbonized debris. Different terms mean the same thing. Think of it like if you scratch yourself and it scabs over, it's like that, okay? Carbonized, but when it comes off, smooth, back to normal. Meds are carbonized micro injuries of skin with underlying regenerative tissues. If you're
Overstimulating might expose immature skin too soon and disrupt barrier formation process. When you get hurt and put Aquaphor or Neosporin, it's like that barrier that protects the underlying skin from getting infected. If you're getting rid of too fast in the process, disrupt barrier formation and trigger post-inflammatory hyperpigmentation, PIH. Red light can increase the circulation and warmth, so therefore might cause extra stimulation, which is unnecessary. Prolonged inflammation because it's still early in the healing process. Okay, if you're trying to show somebody how to cook and you just give a cutting board and a knife and all the ingredients, use this and this, okay, you got it. They're like, wait, what? No, it's too fast. Slow down. Show them, take it one day at a time, slowly, and not speed up the process. If you use red light, it might increase the redness or the flushing of your skin, especially if you have sensitive skin or rosacea. It's controlled damage, so you need controlled healing. Control everything, control your life. I've learned that over the years. Explain it and have an analogy for me to understand a little better. It helps, at least for me. Hopefully it helps you in the process so you can understand it. If you imagine it, you can understand it. It's like exfoliating. When exfoliating, you're using chemicals. After post-procedure, after a chemical pill, you're not supposed to do a lot of things. If you're doing this, you're gonna get a reaction, and it's not gonna be a good reaction. So you need to slow down and take a break. Let your skin heal naturally. Usually your men's off around 5 to 7 days. For me, it's 7 days plus. If I'm not encouraging the men's to fall off, it will be longer, like 2 weeks. I gently encourage it, meaning I massage with my hands when I wash my face or use that silicone facial brush. So just make sure you're letting your men's come off naturally so that you can have all the things that you are wanting. Boost collagen, fade redness, fade pigmentations, fade wrinkles, help with the tone and texture of your skin. You can reap the benefits of your laser treatment because you deserve it. What you should do post-procedure is use a gentle cleanser, something hydrating, barrier supports, creams, products, things like that. Things that have ceramides, hyaluronic acid. Don't exfoliate, don't pick your skin. Once your mints come off, then you can use red light therapy. Just wait till it's like 90% gone.
Hope you found it helpful. I'll add the next clip or picture so you can see my results and how long it took. I did my face, neck, and hands. If you enjoyed this video or found anything helpful, don't forget to subscribe, like, comment, tell YouTube my video was beneficial. I think it'll help somebody. Keep tuned to the next clip. Hey everybody, it's day 7 and this is my face today. My front view, left side, and my right. For the most part, it is 100% gone for my face, and for the neck and hands, it's still there, maybe 20% left. I'm going to stop at the 7-day mark. Most people just do the face, not always the neck or hands. Predict most of the mints for the neck and the hands come off by the end of next week. And if it doesn't, I'll put a note at the bottom. I hope you found this video helpful. I try to be thorough and get as much information out there. It can help you in your post-procedure treatment, and you can decide if this treatment would fit your lifestyle and budget and everything. So if there's anything else you want me to talk about, let me know down below. And again, don't forget to subscribe so I can keep making more videos. And thanks for watching. And I will add my pictures, my final pictures in the end of the video so you can see the differences. I try to put in the same lining and everything, but I'll do my best. I hope you enjoyed it and I found it helpful. I got a new motto. Keep it light and have fun in your self-care adventures. Bye, everyone.